Hi kids, my name is Dr. Steve Elison. I am the Dearborn County Health Officer. I prepared this video with the help of my wife in order to address all of you about how school will be different this year because of the COVID-19 pandemic. As most of you know, this is a novel or new viral disease. This means that it will probably continue to spread until, number one, an effective vaccine is developed, or number two, enough people acquire immunity to the disease by exposure to produce what we would call herd immunity. In the meantime, if we can slow the spread of disease, we buy time for the development of a vaccine and also the development of more effective treatments. Public health and education leaders in the state of Indiana agree that a return to school in the fall is very important. We also have to do the best we can to fight the spread of the virus while returning kids to school. These students are here to explain how school will be different this year.
If someone you know tests positive for COVID and you were recently in close contact with that person, notify your school administrators. They may tell you to stay home for a period of time.
If you feel sick, stay home from school. Contact school administrators to find out when you should return to school.
If you test positive for COVID, stay home from school. Call the school and tell them you have tested positive for COVID. Even if you feel healthy, stay home from school until the school administration tells you it's okay to come back to school.
People infected with COVID may experience one or more of these symptoms: fever, sore throat, cough, difficulty breathing,
headache,
muscle pain, chills, nausea, diarrhea,
congestion or runny nose,
or new loss of taste or smell.
For most children and teens, having a COVID infection will feel less severe than the flu. It will not require hospitalization.
Children with underlying medical conditions like diabetes are at higher risk of becoming seriously ill when infected with COVID.
If you have a pre-existing medical condition, you may need to consider doing online schooling from home. Your parents should discuss it with your doctor and the school administrators.
Many children infected with COVID will feel perfectly healthy and have no symptoms at all, but they may still be contagious and able to pass the infection on to others.
If COVID spreads to our grandparents, they are higher risk to get very sick.
There are things we can do at school to stop the spread of COVID.
Number 1, wearing a mask. Masks stop our germs from going to other people and stop other people's germs from going to us. Number 2, social distancing. Try to stay about 6 feet away from another person. That's about 2 arms length. Number 3, washing your hands. Washing your hands regularly will help stop COVID-19, especially after eating and using the bathroom.
Our teachers and administrators are doing the best they can to learn about the COVID-19 virus, to follow state guidelines, and to keep us safe. As we learn more about this new disease, the rules may change. We need to be patient and be flexible.
Working together, we will defeat this COVID-19 pandemic. Bye, kids.